Hi everybody, I'm Dr. Howard Marshall from New York City, and today we're going to go over gum disease, gingivitis, periodontal disease, and show you where it comes from. Now we're going to look first at what healthy gum looks like. Healthy gum occupies the space between the teeth completely. It is flat, and it has a slightly stippled or dimpled appearance, like an orange, like a navel orange. And you notice there's no redness, there's no highlights on the gum from inflammation. That's what a normal gum triangle or papilla looks like, a normal gum triangle. Now, under that tissue is connective tissue fibers that are organized very carefully to form that gum papilla or triangle. The lining of that is completely normal, it's healthy, there's no inflammation, no bleeding when a periodontal probe touches the tissue. And the bone is usually about 1/8 of an inch under the junction of the enamel. This is the enamel, that's the root. This is the cemento-enamel junction. The bone is about 1/8 of an inch under that in health. Now, as gingivitis occurs, the lining of the gum gets ulcerated, begins to bleed, and in our next page we're going to see how the gum swells, the gum margin is red and irritated, and if we look at the drawing, this lining inside is ulcerated and bleeds if we touch it or if the patient brushes or flosses. However, the bone is still at the same height as it was in the earlier picture. So this is reversible. Gingivitis is reversible. Once the bone loss begins and more connective tissue fibers break down, leading to that bone loss, it is no longer reversible, although treatable. Now, as the bone loss goes from mild to moderate, here's where the bone was originally in the earlier first gingivitis picture. Now the bone itself melts away, spaces open up between the teeth, the lining of the gum is still ulcerated, and more tartar forms actually under the gum lining, contributing to the inflammation, and spaces develop visibly. Also, you may have root recession. Now, as the situation gets worse, you have more and more gum recession on the roots all along, wider spaces between the teeth. You actually may get openings occurring between the teeth as they begin to drift from looseness and pressure of the bite against the weakened bone. And often we will start to see, actually, if we press this gum, we may see what's called an exudate or liquid pus, this yellow, that can be squeezed out of the gum lining. So that's an advanced case of periodontitis. And again, we want to point out that this is measured by the dentist, not just visibly, but by x-rays and the use of a periodontal probe. Now, the periodontal probe is an instrument that, this is a probe, and we see this got 3 divisions where each zone, 4 divisions I should say, where there's a 3 millimeter, a 6 millimeter, a 9 millimeter, and a 12 millimeter mark. This is the probe I use. Other doctors use other types of probes, but they all are measuring either a healthy gum space, this is a 2 millimeter to 2.5 millimeter healthy gum with no bleeding on use of the probe, and the probe is round at the tip. It's not sharp, it doesn't hurt. And you see this illustration is using a 36912 probe. Here, when we have breakdown and we have the bone having dropped, bone having dropped. We have major fiber disorientation. Now the probe from the height of the visible gum line is down about 8 millimeters. And these measurements are charted on a paper by the dental assistant or the hygienist to measure whether each gum space is normal or healthy, and we take anywhere from 4 to 6 measurements around the tooth. Now, if the person loses too much bone, as shown in this x-ray, here's the entire length of the tooth. Here to here is the amount that should have been in the bone. Bone was about this level in health. Patients lost over 80% of the bone. A tooth like this cannot be retained, so this tooth is going to come out. This one, because it's a long cuspid, may be treatable, but this is going to be lost. Now, treatment consists of using scaling and root planing to initially remove the tartar that's reachable with these hand instruments. This is a little metal-shaped instrument that's designed to go around the curve of specific roots. We have them for the front teeth, for the middle teeth, and for the posterior or back teeth, for the molars. The tartar is removed as best as can be done. Sometimes we use an ultrasonic machine called a Cavitron, or there are other new ultrasonic machines today also. Net purpose is to chip away and knock away this tartar under high-speed vibration of the tip of the instrument. Again, no pain whatsoever. So by cleaning this out, by putting a patient on certain rinses, certain antibiotics, we're going for maximum shrinkage. Then we will re-evaluate the patient's tissue and pocket depth in about 2 to 3 weeks and take new measurements. Based on those new measurements and what we saw in the x-rays, we'll make a decision as to whether the patient does need periodontal surgery and reshaping of the bone and perhaps bone grafting. Now, if we decide that the patient does need bone work, bone treatment, let's say the edge of the bone is still abscessed, we're going to make, under anesthesia, again, you do not feel this, but we make an incision through the gum. We lift up the outer wall of gum and we discard the inner wall of diseased tissue. We're now looking at the bone and we're looking at the tartar that is under the gum line at the deepest levels that often the hygienist cannot reach or the dentist cannot reach when he's doing scaling or root planing. It's too far down, too hard to see. But by direct vision, we can see it, and we're going to remove it and have a totally clean root. And then we are going to trim the edges of the bone and make them shaped in such a way that the gum can gently go right back over the trimmed bone, be sutured together, and after healing, this will be the new gum level over the treated bone. And again, the space that comes back after healing is a shallow space that only has a small number of bacteria living in it, and that can be maintained with proper hygiene using dental floss properly, soft toothbrush properly, and perhaps a water pick, as well as certain rinses like Paradex, also known as chlorhexidine. Those rinses help keep the bacteria at a minimal number and totally under control and at a healthy level. So that basically is how we treat the middle to moderate case. What about an advanced case where there's very deep bone loss, sometimes at an angle next to one side or more of a tooth? We treat this similar to the first picture just prior to this, but the difference is after cleaning out the bone pocket, this deep space within the bone, we then implant bone graft material. This is super sterilized material that comes to us in double sealed vial packages, and we put this into the defect, and then we cover the defect with a membrane, and then we cover that membrane with the flap, and it goes back over, and then we will suture the flap together. And after about 4 to 6 months, we hope to see this type of regeneration where the bone graft material is replaced by your own body bone, and you now have more support than you had before. Now, important point, in order to keep these results, it is very important that your hygiene be excellent in terms of flossing, brushing, use of the water pick if recommended, and use of certain rinses as recommended. In addition, you should be seeing the dentist or periodontist or hygienist at least once every 3 months in order to maintain your result. If you drop back out of recalls, we call this periodontal maintenance visits or recalls, if you drop out of that and stop going back in, and you do have some early breakdowns starting again, your dental team will not be able to catch it early and reverse it. So we're going to review the hygiene with you in another session, and we're going to go over proper flossing, proper brushing, tongue brushing, and also the use of the irrigators and the rinse. That's it for today, and I hope you found this educational and helpful in understanding your condition.